Howdy, I'm Jay Widmer, Cardiovascular Fellow here at the Mayo Clinic in Rochester, Minnesota. And we're honored to present to you the results of our recent systematic review and meta-analysis to be featured in the upcoming edition of Mayo Clinic Proceedings, discussing the potential impact of digital health interventions on cardiovascular disease. This project was really born about from our own work in cardiovascular disease prevention using digital mobile health. And we found that despite a multi-billion-dollar industry with new technologies emerging every day, there is startlingly scant evidence in terms of the overall outcomes of digital health and mobile health in the healthcare field. Really, other people have looked at trying to systematically review these topics or even create their own editorials, but the heterogeneity within the industry, among the populations, the interventions, it really made this difficult, and the promise of digital mobile health in healthcare has really been left unfulfilled. Thus, we decided to systematically assemble all of the literature available on digital mobile health and cardiovascular disease outcomes and review this in a systematic fashion in order to see if there is a potential beneficial impact of digital mobile health on cardiovascular disease as well as other risk factors. To do this, we examined over 500 abstracts using typical search engines, and we're able to whittle this down to approximately 50 full-length publications, which were set by a pre-specified criteria. We were able to then meta-analyze data from 9 randomized controlled trials which reported cardiovascular outcomes, as we also looked at risk factors for cardiovascular disease such as weight, blood pressure, BMI, cholesterol, and Framingham risk score in about a dozen other studies over multiple years, which included over 24,000 patients. What we found is that there is a significant reduction in cardiovascular disease outcomes among populations who use digital health compared to usual care. These reductions in outcomes were mainly driven by secondary prevention populations, such as those with ischemic cardiac disease or heart failure, and were largely driven by rehospitalizations, something very important to the healthcare community. We also found reductions in weight, blood pressure, LDL cholesterol, as well as Framingham risk score in primary prevention populations. However, the caveat there is that the populations and the interventions were so heterogeneous, it was difficult to pull any mechanistic details from our study. Interestingly, when we looked at the type of digital health, mobile health intervention which had the greatest impact, we found that those interactive digital health interventions, such as SMS texting, web-based applications, as well as telehealth, had a far significant impact on weight reduction compared to the other modalities. Thus, we're able to present for the first time information regarding a substantial and significant reduction in cardiovascular disease outcomes in patients who use digital mobile health compared to usual care. Despite the results that we show here, there's still great work to be done in this field. Largely, we point to the lack of evidence in reduction of events in primary disease prevention. New studies need to be evolved and described which use larger populations, more diverse populations, different digital mobile health interventions, and cover a longer span of time in order to really pull apart some of the mechanistic ideas and thoughts behind why this might be effective. Furthermore, we need creative research techniques which can keep pace with the ever-changing technology boom which occurs on a daily basis in this field. But we still need to keep the scientific rigor so that we have effective treatments for our patients, which is the bottom line. In closing, we'd like to thank the editors of Mayo Clinic Proceedings for the opportunity to present this video and the results of our systematic review and meta-analysis. We'd like to thank you for your time and would appreciate any comments or thoughts, insights you might have. We hope you enjoyed this video and our systematic review and meta-analysis describing the reduction in cardiovascular events with digital mobile health. And we hope you enjoy this edition of Mayo Clinic Proceedings. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.